Clinical warning: use of retinoids during pregnancy and childbearing years. Overview. Retinoids, including retinol, also known as vitamin A, and its derivatives, are commonly used in dermatology for their efficacy in treating acne, photoaging, and other skin conditions. However, their use is strictly contraindicated during pregnancy and in individuals of childbearing potential due to significant teratogenic risks. Teratogenic effects. Numerous studies have established a clear connection between the use of retinoids during pregnancy and the risk of severe congenital malformations. Specifically, oral retinoids, such as isotretinoin, have been associated with abnormalities in the central nervous system, cardiovascular system, and craniofacial structures. A well-documented study indicated that the incidence of birth defects is significantly higher in infants exposed to retinoids in utero, with a risk estimated to be as high as 25 to 35% in cases of first trimester exposure. Mechanism of action. Retinoids exert their effects by modulating gene expression through retinoic acid receptors. This can disrupt normal embryonic development, particularly during critical periods of organogenesis. The sensitivity of the developing fetus to these agents is heightened during the first trimester, when the majority of organ systems are forming. Regulatory guidelines. Health authorities, including the FDA and the European Medicines Agency, have classified oral retinoids as Category X drugs, indicating that the risks of teratogenicity clearly outweigh any potential benefits in pregnant individuals. Topical retinoids, while less likely to cause systemic exposure, are still advised against due to the lack of sufficient safety data during pregnancy. Recommendations. Women of childbearing age should be advised to avoid the use of retinoids and should be educated about the potential risks associated with exposure during pregnancy. Effective contraception should be utilized in women using oral retinoids, and healthcare providers should implement risk management strategies such as the iPledge program for isotretinoin. Conclusion. Due to the well-documented risks of teratogenicity associated with retinoids, it is imperative that healthcare providers counsel patients on the dangers of using these agents during pregnancy and the childbearing years. Alternative therapies like Azelaic acid or certain safe antibiotics should be considered that have a better safety profile for this vulnerable population.